So I'm not numbing underneath the skin. So putting some anesthetic into these quadrants. Very nice. Okay, look this side. Okay, great. All right. So anesthesia in. So I created a portal, basically a hole to introduce my cannulas through. So it breaking the skin. This is the only break in the skin that's necessary for the cannulas all to work, because the cannulas are all working with blunt dissection, so it's not tearing up the skin as a needle. So these are blunt. So I kind of enter the area, and then I'm just traversing right across subcutaneous skin. So right underneath the skin in the subcutaneous fat layer. So should, if I'm right plane, it should pretty much glide across as I'm doing now. Glide across. Little pain right now. Just bear with me for the just deep breath, because there'll be a little bit of pressure there. Okay, good. So now pulls out. So this is now at the nasolabial fold. As I pull up, you can see that make that nasolabial fold go away. Very nice, very nicely, very natural effacement of that nasolabial fold. So this is the second thread. I'm putting it into the or commissure or the marionette line. We want to take that line away too. So I shoot for that. Right there, I'm at the, see that? You can see the tip of my cannula right there. So I can take out. And so this one will be pulling as such. You see how V-shaping that made the face? Just made it all elevated, V-shaped.
Go.
I like to go with the jowls, where the jowls are. So I'm aiming towards sort of at the jowl, the jowls where the chin meets the jawline, right there. This is the notorious area for fat to collect, and I want to take care of that by pulling that up. So this again makes that V shaping very well. So again, I'm shooting for the jaw line because it's just one of those areas that needs some help, because there's more tissue there to pull up. So I'm gonna aim for that. Gonna right there. So you almost the neck here, there. So there's another one to really essentially give you that V shaping. So the angle of the jaw, where that jawline meets that ramus, I'd like to pop that out so that it's a very useful feature to have when the angle of the jaw pops out. So I'm shooting for that. It's already numbed. So right here, you can see the tip of my needle here already. So right here, I'm gonna just come out. So very nicely. Wait a second. They didn't go again. Sometimes it didn't engage. I'm gonna put that clip as an NG. But okay. Okay, good. Here we go. So there it engages now. See that? Now it engages. So there, when I pull, see that pops out very nicely. So that angle is, when everything's V'd up, that jawline pops out and the angle pops out. So it would be a very nice transition. Looks good. Okay, so I'm going clipping each one of these threads. So this one is the angle of the jaw. So you can see that defined very well right there. You can see that nasal labial fold being pulled up right there. V. Nice. Nice. That's also pulled up very nicely. Clip that. Smooth out the little kinks here. Push it in. It'll pop right in. Pop right into its place. So this is a little hole that's right on the sideburn. Really hides very well. So there's nothing to it. So you can, this line and this line, nasolabial fold and the marionette, is basically erased. So it's a very nice way to V-shape the face and get rid of those lines that form. So everybody gets saggy. We want an anti-gravity and go against that sagging by pulling it up. So this is a good way to do it. Very nice. So just from the top, I can see the one side is just more elevated compared to the other. I'm gonna really yank on this side and make these things pull up as well. Yes. Okay. A little bit of, if you can help me out here, just a little bit of pressure there. For a minute, that's it. It will stop the bleed, and in that area you will neosporin. That's a little hole. Okay. That's the hole that's there. And then after, show her the mirror, and then take the after picture. You have a little swelling, just ice it down. You'll be fine. Tomorrow, maybe even some Motrin if there's pain, but okay. It should be okay. You did so well, so I anticipate that you're not going to have much of pain. So,
thank you.
Because these things don't get trauma because there's
okay.
blunt. These needles are not really needles. These are sort of, blunt stuff. Mm-hmm. So you're going to be fine with that.
Sounds good.
Okay. This is a new Laser MD. Always here to renew your youth and beauty. Today we did it with PDO Threadlift. So these are blunt cannulas introduced in various areas of the face to yank up and to lift up from sagging skin, so you get a youthful you. That's what we want. Thank you.